Welcome to the Coast Podcast. I'm Emily, a virtual assistant agency owner who left Amazon in 2019 to build my dream.
And I'm Whitney, a freelance writer and communications consultant who never felt at home in a cube farm.
We wanted to learn from people who paved their own ways like we did. So we created this podcast to talk to others who are brave enough to pick a different path. Creatives, entrepreneurs, people doing their careers and their lives their way.
Join us as we make new friends, get inspired, and show you beautiful paths less traveled.
Not every road leads to the coast, but the ones that do come with a great view. Hi everybody, and welcome back to another episode of The Coast. My name's Emily Given, and I own a virtual assistant agency in Lynnwood, Washington.
And my name's Whitney Popa. I own a communications consultancy in Edmonds, Washington, and I was so excited when, sorry, this isn't about you yet, Allison, it's still about me. I was finishing the Real Housewives of New York reunion last night, and Brynn Whitfield called herself a communications consultant, and I was like, thank you, because I made up that term, and now you are that too, and now I feel validated because you said it on this national stage. So the point is we can all make up our jobs, which is kind of what Allison, our guest today, did as well. Great segue, Whitney. She is the owner of Body Motion Physical Therapy in Edmonds, and we just learned, so Edmonds and Poulsbo, which is across the water from us, and the best-selling author of Restore Your Body After Kids, The Secret to Avoid Peeing Your Pants and Achy Joints as You Age. She helps women from fertility, pregnancy, postpartum through menopause live with vitality and energy so they can avoid leaks, pains, injections, surgeries, and other medical procedures. That's so awesome. I love your bio, and thank you for being here, Allison.
Thank you for having me. I'm excited to chat with you today.
You are a person who has been around town kind of like me, where I'm like, I keep seeing these little threads back to Allison. And that started for me when I kept seeing your newsletter that you put together at Bar 3. And there's a lot of cool integrations that you do because you do work a lot with moms, but not necessarily. It's obviously mostly focused on women. So we're curious how you got to become Dr. Allison interested in pelvic floors.
Yeah, so funny. It's a long story. You ready for it?
Yes, you're ready. This is your space.
Awesome. Well, no, thank you so much for having me. And yeah, I know I feel the same way about you. It's like you just pop up everywhere, and I'm keeping like, what does Whitney really do? And then I look and I'm like, well, she does a lot of things.
Yes,
so,
correct.
No, it's great. Yeah, and I'm glad that, we're so grateful that Bar 3 has had our newsletter, and we love the newsletter, and we do a lot of local collabs. So just to support the small business and really bring the community together and to provide resources for our moms that come here and the women that come here. And you are right, we mainly treat people that have female anatomy, and yeah, for a lot of reasons. I'll get into it. But I became a physical therapist. I played hockey in college. I thought I was going to become a sports rehab physical therapist. I was going to work with hockey players, adult athletes.
That's so cool. My oldest son is a big hockey player, so that's awesome.
Oh,
yeah.
Really? Where does he play?
SJHA.
Oh, nice.
Yeah.
Okay.
Yeah.
My son just started there, Mighty Mites.
Oh,
So.
That's so exciting. Yeah, that's cool. Maybe I'll see you at the rink sometime then.
What age is he?
He's a 16U this year, I guess.
Oh, wow. Okay.
Yeah.
Nice.
Yeah.
Oh, so
but we're there all the time.
Yeah, it's hockey is life.
Yes.
It is your church, right? That's what we always say.
Sorry, I didn't mean to cut you off. I just
No,
got
that's
excited.
okay. Yeah, that's super exciting. I grew up playing SJHA too.
Oh, that's awesome.
Yeah. But let's see. I went to PT school, and in PT school, I, thinking I'm going to be this like sports orthopedic doctor, I realized we had a lecture. A woman came in, and you get one lecture on women's health, right? Like one lecture in the 3 years. And they're like, she told me about, people pee their pants and we can help them. And I had been an athlete growing up, and I had always peed my pants, like from 6th grade on, from what I can remember. I played boys hockey, so I would get hit. I would pee my pants every time I got hit. Super embarrassing. You don't talk about it. Finally, in high school, I was a little validated because like all the girls on the softball team also peed their pants during sprints. And I was like, perfect. I'm super normal. Come to find out that's like very common, but not normal. And so when I met this lady in PT school, I didn't want to talk about vaginas. Like, I didn't want to have to help people with their vaginas. I was like, that's like a scary area to go, right? And takes a lot of vulnerability, even as a provider. But I was drawn to her because I had these issues and I was like, I want to help people and I want to help myself. Like, I don't want to pee my pants anymore. And so I kind of latched onto her and she took me under her wing and mentored me. And I was like, once I started helping people with this, I was like, I just have to. Like, it's my calling. Still did the sports orthopedic thing the minute I got out of school, but started a pelvic floor program at that clinic. And so spent my first 3 years doing a lot of sports and orthopedic rehab and pelvic floor as well. And, so we kind of help people with like the incontinence piece. So anyone that peed their pants, I would help them with that, or people that had painful sex, I'd help them with that. But to do it in a setting in like your standard physical therapy clinic, you think of a physical therapy clinic, you probably think of like a medicine ball, some weights,
Yeah.
a gym area. That
And
is
like
just
curtains, curtains in between these like massage looking beds.
yeah. And so that's your standard clinic. And so to like think like, I'm gonna go take my pants off behind that curtain or behind that door, and there's all these like men throwing med balls in the gym, and that's just not that relaxing. And also a little freaky and scary. So I really decided, I was like, I want to go on. I knew I wanted to have my own clinic and I didn't know how to do it the way I wanted to. I started a mobile practice right after I had my second kid. And I kind of skipped ahead, but let me back up 1 second. So then I had my daughter, and I thought I had trained my pelvic floor for birth because I was this pelvic PT. I did all the exercises and training I knew that I give clients. And then I'm like, holy shit, can I swear? I'm
Yes,
like,
yes. We encourage
Yes.
I
Be yourself.
perfect. I couldn't believe how like ill prepared I was, even though I thought like, oh, pelvic PT, we're like helping people. And I really was. I truly had like this idea of everything I was doing to help people prepare for their birth journeys. And I realized how underserved not only I was myself, but then my clients, just from hours of pushing, being super athletic, having a tight pelvic floor, having tight hips. And it's a really common pattern that people go into with childbirth. And so that's when I started to get this inkling like there's more to it, and there's more to just like standard physical therapy and standard physical pelvic floor physical therapy than what's out there. And so I knew I wanted to do something on my own, and that was kind of like the ticker. I I did a more flexible job working like home health and geriatric care after my first daughter, and what I saw there, and it helped shape me truly, because every single older person in this whole world is peeing their pants and no one gives a
Mm-hmm.
shit because they're all doing it. And it's
Yeah, it's so
legit
sad.
it's what kills them. And no one actually
Mm-hmm.
realizes this, but when their wounds get infected, eventually you get wounds because you can't move. When your wounds get infected because you're peeing your pants and pooping in your wounds, then you die, right?
Oh my gosh,
And
yeah.
so like they're like, we don't really care that people are peeing their pants. It's a multi-billion-dollar industry to be having pads and pills to control bladder. But by the time we're in our like 70s, 80s, most people have such long problem lists. They have heart pills, they have thyroid pills, they have
Yeah.
all these pills that like, who cares that they're peeing their pants? Like, it doesn't matter.
My grandma cares, and she cares a lot.
Awesome. That's so
All
good.
these things, but like not necessarily in a super productive way. Like, she's super prideful. It's just started happening. Like, she started falling because she was going to the bathroom in the middle of the night and tripping on the way. And so my mom got her all sorts of different things, little porta potties for the side of the bed, diapers she didn't want to wear. And even now, we just a couple days ago we were talking about Thanksgiving and wanting her and Papa to come over. We would even send a car or whatever we needed to do to get them over here. And she's constantly worried about where the bathroom is in a different environment. She says she called my mom yesterday freaking out, saying she can't leave her comfortable environment because she said she's a little tippier than usual right now and doesn't want any, like, she won't even go to church because they were working on the bathroom,
Yeah.
and she doesn't want people seeing her like an invalid, and not to mention the addition of peeing her pants.
Right. Yeah. No,
which is just awful.
and now it's controlled her life, right? And that's going to make her
Yeah.
more sedentary because she can't leave her house
Yep.
and she's not going to do all these things. And that is really going to impact the quality of her life.
Yeah.
A lot of people that are in like kind of that 40 to 50 range, it's when they come to see us, they don't actually really, they're not concerned that they're peeing their pants. And it's not as concerning of a symptom. What's more concerning is that if you are peeing your pants, that there's just more happening there. Your core isn't working for you. And if your core is not working for you, then your hips take up more impact, your back takes up more impact, your knees take up more impact. And so it's more than just like I'm peeing my pants. It's that I want to not have a joint replacement. I want to not have to take, injections in my knee or get Botox in my bladder. Like there's just so much more to it.
Botox in the bladder
Yeah,
is a thing.
it's a real thing. So a lot of people that have urgency, like feel like they have to go all the time, that's what the urogynecologists and urologists are doing right now. And then you want to so then what happens is people want to get off the Botox. So I'll see them when they try to like wean off the Botox essentially. Because, to like be poking yourself up with needles by your bladder isn't like that you don't want to do. No, who wants to do that? Who wants to put a needle up there, right? So, yeah, it's a thing. It's to help so you can, especially for older women, make it through the night and to decrease the urgency. It's across the lifespan, really, but very much more common in older women. And I think it's because they're just like, too late for anything else. But I totally segued where I was, kind of in the story of
Yes.
how this started.
Your origin story. You had your first child.
Yes.
And then you did, after your second child, you had your mobile practice.
Yeah. And so really after that second baby, I decided that I had to get back to like really treating pelvic floor and like when it really matters. And, I ideally, if everyone could have this type of care premenopausal, we could prevent this soliloquy of aging and like these soliloquy of like the joint replacement and then the eventual nursing home and the eventual diapers and the wounds, right? Like if we can just stay healthy and like, yeah, it takes work. It's not just what we do here. You have to keep your body healthy, but what we do here is a super important baseline for starting that journey. And so, yeah, that's my origin story. Started as a mobile practice.
One of the things that I always get hung up on, and something that my mom and I adopted when my dad got sick, she was always this way, but I really saw it in my 20s when he got sick. And I was like, oh, dang, you really have to be preventative about your health and proactive and advocate for yourself in this big way because so many reasons. And one of the things that comes to mind with people we interview like you is often I would imagine you're seeing people when something becomes acute. They're peeing their pants. They don't want to anymore. They're embarrassed about it. It's probably been going on for a while and they haven't felt like they could talk to somebody about it or it wasn't dire enough. Is that true? Like, are you seeing mostly people who they're not necessarily thinking, I should think of my pelvic basket before I'm 40? There's probably some awareness building that is just really excruciating. I don't know.
Yeah.
And then also, how are you advocating for people to be more preventative in their, especially down their health?
Totally. That's such a good question. And I will answer it in a totally transparent and honest way because I think it's important to get this out there. Thank goodness I learned marketing because it allowed me, and if most of your listeners are entrepreneurs, you know that marketing drives every single thing that we buy, every single thing that we do in the morning to everything we go at night. Every single thing is driven by what is marketed to us and what we decide is important and valuable to support our lives, right? So I was so fortunate to, really study marketing when I opened my business. And it was due to the fact that I needed to get clients, right? And I didn't take insurance. I wasn't going to be your standard, like, you have to hit these goals and you only get 6 visits to do it. And we're only going to look at your pelvic floor. I just had no interest in treating that way. I want to treat the body and really help people live like their best, most optimal lives. So what there's so much, that's such a loaded question. So I'm like trying to find my words to answer that appropriately. But what is very true and real is that not all pelvic PT is created equal. And so it is really common if you have an acute symptom and you get a referral from your doctor, you're going to go to a pelvic PT, maybe at Swedish, maybe at some other clinic that accepts insurance, and you're going to try that route. Usually you're going to be given Kegels, you're going to be given exercises, all shit you can find on YouTube that you can learn to do yourself. What makes us different and what's really truly sets us apart is that, yes, we'll make sure you have some programming to reinforce what we do, but we change the quality of the tissue, not just the pelvic floor, a lot of the pelvic floor, but the quality of your hips, the quality of the tissue that supports your core. And if you're not doing that, you just don't get to generate these really good natural force absorbers. So I train a lot of pelvic PTs, and I get to see what's out there because I hire a lot of people, and I also train people across the US. And when I do this, there is such a disparity in the level of treatment. So if you go to someone for incontinence, I'm peeing my pants, I want to get better, they're most likely going to give you some relaxation techniques, and then they'll start to give you exercises. But what isn't being done is you're not unpeeling the compensations. So if your body was an onion and you develop these compensations, these patterns that your body just does, a lot of times after childbirth, a lot of times if you tore your ACL when you were a teenager, you get these compensations. You bear weight more on one leg than the other, and you get these asymmetries. And then the body's amazing at healing and can just compensate. And so we develop these compensatory patterns. And so if you're just kind of going to a PT and then they're just building on those compensations without undoing them and teaching your body new patterns and healing that tissue that has all the compensations, then that's going to be a problem because these results are not going to be lasting. You're not going to get better. And so to answer your question, we don't get a lot of people. We do get people in that acute distress moments, but we usually get them after they've already tried pelvic PT. And so we're like the second stop shop for someone who's gone to all the other clinics. The other thing is they've gone to those clinics and they've gotten, a little bit better and had some improvement. But then like their friend came here and they're like, I want what you guys do. And I want that on like a monthly basis because now I feel really good. And so people will come to us for that. And then the other way they come to us is through marketing, and just we market prevention. And it's a harder thing to market for sure, because it's not like, the emotional ties of being in distress and peeing your pants are there. But it's so important. And so to market that and to know how to market prevention is really important. And so we've created that. And I think that is a tribute to knowing how to market. And that's what makes us really different. And that's what makes this clinic so fun, is because like actually we work with like super fit, healthy people, not fit, healthy people, and whatever it is that you do. And we just get to kind of help them optimize their internal workings, their body, or whatever they do. And I do just attribute that to the marketing. And especially when it comes to fertility, when it comes to childbirth, you can't go to a pelvic PT for fertility around here. I don't know anywhere that does anything close to what we do that will actually help change your tissue to optimize your body for fertility. It's just not, people don't do that. And insurance doesn't pay for that because they don't pay for prevention. And so
I was just talking about that this morning when I was trying to get pregnant with our son. On my 30th birthday, I went and got, you probably know the term, it starts with an H, like a hysterectomy. It sounds like hysterectomy, but it's not. It's where they put the dye through your tubes to make it easier for the sperm to do what they do.
Yeah.
And I imagine that like what you do is like the beginning of that, like making the hospitable environment from, the opening into the tubes or whatever. I think I went through insurance for all of that.
Yeah.
But
yeah.
I think that's really cool that I wouldn't even think about. I love that you market it as like a whole motherhood journey thing, like beginning from even when you're thinking about it and before that for athletes, we all need help with our vaginas.
Yeah.
And you're here to do that.
Yeah. So I'm fortunate. I get to also, I teach at Swedish every quarter to onboard their new nurses or new OB nurses. And I get to teach them different ways to help support clients breathe babies out and to deliver babies with less trauma to the mom. And it's good. It's, I don't know how much of it they carry through to practice. I hope they carry through what we teach our clients to advocate for. But, that's one level of like trying to make change, right? At that kind of birthing level, because most people are just cued to like hold their breath and push their babies out, and you pop a lot of blood vessels and you push a lot of organs out for the rest of your life. And it's hard to get them to go back to where they want to go. So you end up with these things called prolapses, where the organs sag a bit into the vagina. So, they a lot of times can be prevented if we have, a pelvic floor that can open for childbirth and don't have to push for hours. So that's one of the things I will teach at like the hospital setting. But I keep saying to people, I'm like, my next stop is going to be like your health class when you were in 5th grade, like, because we need to teach girls, especially girls, we need to teach them to relax their pelvic floors. Like, and my daughter's a gymnast, and like, I'm like, when you go on the toilet, like, you have to breathe. Like, we have to open this up, instead of like being pushing down and bearing down. And she's doing that through these really tight pelvic floor muscles. And so many girls, no one teaches us to connect to our vaginas. It's so taboo. We're not like, hey, this is a great piece of my body, right? We're like, put some underwear on it, put pants on it, cross your legs, don't show anybody. Yeah, okay, all that stuff is great for our society that we live in, but like at the same time, like, let's make sure that you know the motions of what this muscle can do, because it's a super imperative muscle that's going to control your body. And so many girls starting at a young age don't ever get range of motion of their pelvic floor. So it's literal cement. So of course all their other muscles have to be dominant.
Wow.
And yeah.
I'm curious if I have a friend, a local friend too. I know quite a few moms who had their babies and then immediately went and worked with you to strengthen their muscles and do all that, which I think is amazing. I wouldn't have even thought of it. And so I'm curious. I'm a person in the world. I've had 2 babies. Let's say I'll just use me as an example. I don't pee when I do sports or activities, which I guess is
Fantastic.
uncommon.
Yeah.
Yeah, and good for me. And my basket is tight. But what would be the intake process for me and my potential journey with
Yeah.
you coming in?
Yeah. Can I just interrupt you on that thought, like that
Yes.
question? It's so a lot of people, it's not about having a tight basket. And that's what I think is the biggest misconception. So people think I need to do Kegels, I need to tighten these muscles. I feel
Mhm.
just blown open after having kids. I can't hold anything in. I don't even feel my partner when they try to insert when we're having sex. I can't orgasm that well. And it's not usually, especially premenopausal, it's very rarely that it's like, oh, I need to tighten these muscles. These need to get stronger. And that's why like everyone's done Kegels and they haven't worked, right? Pretty soon we'll say everyone's sat on the freaking chair that gives you the shocks and it doesn't work. And there's a reason for that. And it's because we don't need to over facilitate these muscles. They're already over facilitated. They have studies that show women that walk down dark alleys when they have electrodes on their perineum. So they're measuring how contracted the pelvic floor is.
Dang, who would sign up for that?
They walk.
That's a scary study.
Right? They walk down a dark alley and their pelvic floors immediately contract. And they
mine's contracted all the time.
Yeah.
That's probably why I don't pee.
And they don't let go. Well, so that's not though. So there might be some other factors here, but we don't want it contracted all the time. We want it to open and we want it to have this range of motion. The quality of being like a really good shock absorber or like a piston or a spring is that it can relax and contract and overstretch. And for most women, it's actually just tight and contracted. And it doesn't have that full range. And so if it has that full range of motion, every time your foot hits the ground, when you're walking in an exercise class, doing a squat, your pelvic floor is just naturally going to work for you. It's going to naturally contract and work as the shock absorber. You don't have to think about keeping it tight. But if it's constantly tight, what ends up happening is you increase the pressure, and that can push down the organs. That can have a lot of impacts. And then it's also more cement-like, so it's not going to have that slinky effect. Does that make sense?
Yes.
But so I interrupted your question because I just wanted to so many people think that. And actually,
no, please, yeah.
When you get that recoil and you get that mobility, it makes sex and orgasming so much better. like so much better. And so it improves pleasure that way. But now I don't even remember your initial question.
I am curious if I just want to be preventative in
Yeah.
all ways of my life, what my journey would be. I would fill out the form that says I've had 2 kids. I don't pee when I do sports, but I feel like there's always room for improvement. B+
Totally.
for me. How do I get to an A+?
Yeah, for sure. So you would come in for a consultation. So we do those complimentary, and we go through your entire history. So surgeries that you've had, injuries you had, we just what sports you played growing up. So we kind of like know your body patterns. We learn them through different questions we ask. We go through how your bladder functions, how often you pee, how frequently you have to go, any leakage. We go through bowel movements and how your poop is, how easy the poop is to get from your body. We go through sex. How good is it for you? How good does it feel? If it doesn't feel well, we go through like what's initial penetration like? What's deeper penetration like? What is yeah. So we ask all these fun questions. We talk about abdominals a lot. So if you've had any abdominal surgery, one of the biggest things that is really important when staying really healthy in our entire core is how our organs move inside of our abdominal region, inside of our bodies. And so the organs should naturally move and ebb and flow in our bodies. And if that's happening, there's a lot less pressure down on the pelvic floor, down on the vagina. So we do a lot of like we play with the belly organs. It feels like a belly massage essentially, but we call it visceral manipulation. So moving the organs around, getting things to shift into the places that we want them to be, giving your body that natural movement, which then can improve the power of which your core can work abdominally. And then also, then we would, suggest an intravaginal assessment of your pelvic floor and see how well those muscles are functioning. In the consultation, if you've had kids, we'd go through your birth history, we'd go through your fertility journeys. A lot of times when people end up with IVF, IUI, and just like the perpetual fertility journey, those pelvic floors and people tend to have a lot more tension through the tissues. I think it's probably from like a stress of it all, but also there's just a lot more underlying there. A lot of people that end up with going on some form of fertility journey with the IVF tend to have more C-sections. At least that's what I see clinically. I don't know how much, I know that research supports it, but I don't know to what extent. And there's also this bias because providers tend to categorize them as more high risk. And so then they just opt for C-sections. But from a clinical standpoint, we see a lot more. If it was more an IVF pregnancy, then if someone was coming to us pregnant, we would know that they probably have a lot more tension and shortening of the pelvic floor that we would want to work on if they were trying to have a vaginal delivery. But I'm going off topic because that's a very large question of how we would handle all of these. But yeah.
Yeah, it's really helpful. And it makes me think, and this is somewhat adjacent to what you do. I'm curious about energetics and mindset of people who come in as well, because to your point about IVF, people, even for me, because I saw a specialist twice, I got pregnant naturally after that dye through my tubes thing. And I don't know if that they necessarily were related or if it was a mindset thing. But I was marked as high risk because I had seen a specialist twice. And I was like, I'm not high risk. I know that I'm not. And I really had to advocate for that. And especially when I changed from an OB to midwives, then I believe very much that people who are marked as high risk believe they're high risk and opt more for the C-section for that reason. Do you end up having to, I mean, naturally you probably do, but like any sort of counseling around mindset and perceived stress and things that people come in with this other baggage that contributes to the very real things going on with their body that you have to work through with them as well? Do you feel like, I mean, that you probably are like, that's not even my place, but I'm sure people come in, even the embarrassment of peeing, that's at least part in their mind, something that you have to work through of like, they identify as a person who pees their pants and then they have to become a person who doesn't pee their pants. And what does that look like? It's probably this whole mind, body, soul journey that you have to go on with them.
Oh, it's 100%. Yes. And so fortunate to do that every single day. And yeah, there's there's not like a clear answer for that question, but absolutely. I mean, people joke that like we're their therapist, not just their physical you know, it's not just physical. It's definitely there's a whole spiritual connection of how you perceive your body and its functions. There's just it's so much every single day.
Yeah.
A lot of that, you know, we do throughout like our birth prep protocols. So we have certain protocols that I created that all of us here in the clinic use to help prep women for vaginal deliveries and to really help, because one part of our mission is to decrease the C-section rate in America. And the reason for that is because when you have a C-section, your core is cut. Unless you go through rehab to like really turn it back on and get rid of the scar tissue, dissolve the scar tissue and retrain the muscles after that, you have compensations that lead you on the spiral that we talked about earlier. So yeah, and I mean, they cut through so many layers of tissue and muscles, and that creates a ton of scar tissue, and you have to melt it away and then rebuild it back. Yeah. And a lot of people don't do that or don't have that ability to do it. And that just leads to part of our issue. We have shockwave therapy now because we do so much manual work. And I'm like, why are these C-section scars taking me so long to dissolve? And I'm like, I'm not getting them fully. And then I would see someone on a maintenance program and I'm like, how come your scar keeps bounding down like every 3 months? And I was like, I was so frustrated with this. So then I got this tool. It's called Shockwave. And it is awesome. It's used in cosmetics a lot too, for scars, for wrinkles, for body contouring, but it can dissolve these scars very, very, very well. So we use that here. Mm-hmm.
Yeah, Carly at Iris Wellness has a protocol that she's using to help people with their numbness and pain around their C-section scars. And I think there's a lot of synergies between you two with her approach with Eastern medicine, and that could be really beneficial to women, because part of what you had in your bio too was, and what part of her mission is that you're so aligned on, is getting women to stop having so many surgeries and have to take so many pills and cure things through these Western mechanisms that are a little, in my opinion, this is just me as a layperson on the street, distrustful of your own body's ability to heal with the support of somebody like you who knows what they're doing. There's so many things that you can do for your body before you have to go down those trains. And I'd love if people were just more aware of that you don't have to go get the tummy tuck or whatever it is, like a bladder surgery, etc., when you have these resources that are somewhat untapped. And like you said, Allison, a friend comes and says that they saw you, and you're doing a great job with marketing too, but it's often they have to have that personal touch point before they give themselves permission to go in.
It's totally, and that is the permission, because it's like, if things aren't that bad, life is already hard. Like, you have so much going on. We're all trying to work out however many times a week. We're all trying to keep our flexibility up, our strength up, right? Maybe get some IVs, maybe you go to red light therapy, whatever it is that you do, to like feel good. And so to think that you need to add something else to the list, it's hard. It's a hard pill to swallow, but it's like, I mean, I'm in the pursuit of optimal health. So like, I am doing everything I possibly can, like exactly what you said. It's like, how can you optimize your health so you can like continue to be this like supple 70, 80-year-old, right? It's like, that's what the goal is. Like, how can we get there?
My mom's going to be it. My mom already is.
That's awesome. Anyone, I would say, like, who wants that prevention, get range of motion of your pelvic floor and get it, like, come in and check it out and come to us. I'm so biased, but I've had a really rough week, really rough month. And I'm just seeing these freaking stories of what pelvic PT is out there. And it's horrendous. And it's not pelvic PT, or it is pelvic PT. And what we do is not pelvic PT. We're like full body optimal wellness essentially here. And it's different.
I'll send my mom over because she is the furthest person from prude. And even my cousin, who we've had on the podcast, has sugared my mom's vagina, which makes me very uncomfortable. And so her coming in and doing manual whatever with you is like just no skin off her nose, She's like, okay, where do I sign up?
No, and it'll improve her hip range of motion. I don't even know what her hip range of motion is, but like, people don't, like, when they're like, my hips are chronically tight, you get this pelvic floor treatment and your hips are open, your back, all the stress is off your back. Like it just is different. And yeah, I'm obviously super biased. And I also want to know, who's your cousin?
Oh, my cousin Chandler, she owns Sugar and Co., which is in North Seattle.
Oh,
And
nice.
she's
Okay.
amazing
Okay.
and super fast. She lived with us when she was doing her advanced sugaring training for 3 weeks. So every time she came home, we were so excited to hear who she did and what it was. And now she's been sharing on her Instagram more of what her day looks like. And it's all these manzillions. And it makes me so excited.
Oh, I love this. I'm going to have to follow her and go see her.
Yeah. She's so funny. She makes me cackle. We're 7 years apart, and she's just always been my favorite family member for so many reasons. And she's just like the driest, funniest, best person. And a couple of our friends started going to see her afterwards too. And they'll text me, they're like, in and out with my Brazilian in 10 minutes. It's great. Chandler's the best.
I love that.
And she is. That's a collab right there. Like, because I was actually thinking about that when you were talking. You know, how when I was like the first time I went to the gynecologist, my mom took me to get a pedicure because, you know, you're going to have your feet up in the stirrups. And the next step is making sure you feel groomed to your comfort level there as well, because you might as well feel good, you know, going into whatever it is, whether you want to have a full bush or whether you want to be clean as a baby.
Mm-hmm.
Do what's right for you and go see Allison and feel good while they're penetrating and making you feel even better in the future.
Perfect. Yeah, no, that's funny. That's great. Perfect collab.
She would be. She's just so awesome. And her whole day, it's like maybe an underarm, maybe a lip. She's not doing any brows. I only go to see her for brows and mustache because she was like, I'd sugar you. And I said, absolutely not. I don't. I have to draw the line. The only person she says she won't sugar is her mom because she's not going to sugar where she came out of.
Mm-hmm. Yeah. I won't treat my mom. She sees the other therapist here. Like I draw that line too. Totally.
Yeah, it'd just be too weird.
Mm-hmm.
Are you over in Poulsbo? Do you go to Poulsbo or you just have an office there?
No, just have an office there. So Dr. Riley is the director in Poulsbo, and then I'm the director here right now. Hopefully that's
Very
to
cool.
change in the new year. Yeah, I love it. It has like, the reason I chose Poulsbo is it just has like the Edmonds vibes a little bit on a different level. It's definitely different out there, but it is, I just love it. It's cute. It's lower pace. Everything about it is nice.
You said too, you don't want to be the director for long. So are you giving us an exclusive into what your next step in your journey is?
Oh, the next step in my journey. Yeah, it's been so funny. It's all over the place. I do some consulting and some teaching other pelvic PTs and also helping them learn how to run their businesses, so they can help more people and help more women and get, do what we do. And so it's that I get a ton of fulfillment from that. That's really my passion right now. And there's more to come, but I'm so in the thick of it right now. We've just had someone on maternity leave, so I'm a little sucked back in and hiring like crazy to meet the needs. So it's a great place to be, and training lots of folks. So yes, I will not be the director for this coming year. I do have someone lined up that will be taking that position.
Very cool. The last question I want to ask before we get into rapid fires is, because I'm getting fired up, is do you get super fired up about women and women's health and the fact that there's such a big lack of awareness and emphasis and research and et cetera, in, an empowered way of like, I'm going to help change the wave here, but also sometimes I get frustrated that it's so lacking in so many ways.
Oh, totally. Yeah. Right now, I'm honestly just so frustrated. I get so fired up and I am like so passionate about this, and I want to almost eradicate joint replacement for women. And I truly think the way to do this, because women have much more joint replacement than men. And I do think the way to do that is through the pelvic floor and teaching us how to use our pelvis and our hips and all of it. And so, yes, like so much so. But I think that is long had, because so many people make so much money off of us using pads and us using and getting these joint replacements. And like, there's not a lot of incentive for prevention. Like there is not, for someone to make money off that. It's just not there. Yes, I get so fired up about it. I get fired up about people's birth stories that shouldn't have been. I get fired up about people's recoveries that never happened. And now we're 10 years out and they have debilitating sciatica. And then they've gone to 3 physical therapists and haven't gotten help, or, they're the only thing that keeps them in the train is maybe a little bit of chiropractic here and there. But it's those stories. And I guess I'm really angry right now this week. You're catching me angry this week at the pelvic PT for profession. It's just underserving to so many degrees. And yes, like we are pelvic PTs, but what we do is like so different. I can't even put words to it. And I tried to this morning as I was driving in on my little voice to text because I was raging. So yes, I do, because I think it's so important. And I think if you even had pelvic PT and you're like, I don't know what she's talking about. I don't feel any of those changes, or my hip still hurts, or my SI joint, or my back, or my knee. It's because it just wasn't all put together for you, and maybe it's time to try something different. But most people try something once, they'll go to pelvic PT for a little bit and it didn't work, or it didn't help. And then we're just back to square one, right? Or we're just like semi better. And like, I don't like to play that game. I like people to like truly feel like so optimized and supported through their health journeys. And our bodies change so much. Like if you want to go train for that marathon, go train for that marathon. If you want to do some like CrossFit competition, let's do that. And just realize like your body's going to change and take a different path every time you do something different. And so that might mean that we have to just keep you maintained. And so that's why we have like a monthly maintenance program. Yeah. Okay. That's my tangent.
That's cool. Monthly maintenance program.
Yes. Yeah.
It just makes me think of Varsity Blues, like vagina, 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 or penis, 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 vagina, vagina, vagina. And I think you should be in every health class. We didn't have any of this shit.
Right?
I wish I would have known to connect to my vagina. Sometimes I do feel very disconnected from my body. And I think that's very common in women, to be kind of outside of our bodies and ashamed of certain things, or even that we have vaginas,
Yeah.
Whether that's a conscious thing or not.
Yeah. And we haven't even gone there, but like, I mean, very much so in a lot of different, meditation practices or different spiritual practices, people talk about the chakras, and you talk about your root chakra, your sacral chakra. And like so much of that is in the pelvis. And even if you're like, what the heck? What does that even mean? If you're like wanting to improve your spiritual journey, get pelvic floor work done, because it will help open up so much of that for you. And it's so personal, but it helps that spiritual path too, because our tissue holds so much. Sorry to interrupt you, but yeah.
No, that's a huge retweetable moment if I'm going to be Oprah for a second, who is the queen. That is so important, because even for me, I've been realizing, I can talk and intellectualize my experiences, my feelings for the rest of my life. And I heard on Organic Olivia's podcast, on her latest episode, about a hormone doctor she said, a hormone doctor who speaks to the soul is the name of the episode. And it's all about connecting what she does hormonally especially with PCOS sufferers. But there's so much energetic and somatic work that need to do as a woman too, and how much we store in our hips. And it made me really think, because they mentioned talk therapy is only 30% effective, because you're reliving your traumas versus getting them out of our bodies, which is becoming so much more known, which I think is helpful for a lot of our causes. Even me, in the past year, I've had to think shaking things out of my hips a lot more. And I used to I would be embarrassed to move my hips, to dance at all. And now I'm trying to move my hips all the time to get that stored energy out. And I'm even at the point, like, that podcast really kind of affirmed for me a thought of I would like to use the money that I'm spending on my therapist in other more body driven ways. So maybe I'll be at my consult soon and be doing a maintenance plan so that I can be more spiritually connected. That's such a huge point that often is not communicated. I don't think they just think that person's going to poke my vagina.
Right. Yeah. Well, and that's why, like, there can be a lot of release that happens here. People cry on the table, people laugh hysterically on the table. And like, you're just like, okay, whatever comes out, like, we just let it flow. And it's safe to do that here. There's not a gym here. These are private rooms.
Yeah, so we're all going to Chandler, then Allison, and then we're going to shake our hips at like a cacao ceremony. Not to undermine it, but seriously, that's what I would do.
Or
Go
at your
out.
dance gala, or I don't know if it's even dance, but your Christmas gala, your Christmas party.
Yes, yes. We're
Yeah.
going to be shaking our hips hard and
Nice.
having all the bidding on auction items for things that you can go and do after
Lovely.
that will help you spiritually. So let's go into rapid fires. What are you proudest of in your business right now?
My team. Yeah. They just are
That's
amazing.
such a big thing.
Yeah.
Yeah.
Oh.
It's major too. Like, it's a statement, but it is so important as people who have been on teams, built teams. Oh my gosh.
Mhm.
Such a good answer. Tell us about a book you read or podcast you listened to recently that changed the way you're thinking about your life or your business.
Obsessed with My First Million. I don't know if you listen to it. It's freaking dope. It is the best right now.
Okay.
What's it changing for me? I'm just thinking bigger.
Yes.
So love it.
Yes.
Mhm.
If you've never read Think and Grow Rich, I'm reading it right now, and you think it's like, oh, it's this old school man book. Oh my gosh, it's amazing. And all these things that people teach now about money are so rooted in so much that's been around forever. And it's so fun for me to go back and read the stuff that
What's it called?
built Think and Grow Rich by Napoleon Hill.
I write this down.
And he was buddies with Andrew Carnegie and spent 25 years gathering information from all these old school multimillionaires to put in this book. So it is a little sexist in that way because he mostly talks about men, but the content is similar to a lot of this other stuff that's really popular now and that women teach on. Just pick your teacher, but it's cool to see the foundation was set by all these people from way back. I think it was written in the 60s.
Cool. I'll get it for sure.
And I'm going to listen to Your First Million. Thank you. What would your last meal be?
Ice cream.
Nice. Any specific kind?
Probably mint chocolate chip.
Okay. Green or white?
Green.
Okay. What's the best business purchase you've made in the last 6 months under $100?
Ooh. I don't even do the purchasing for my clinic.
Love that.
So yeah, I don't know.
Okay, we'll skip it.
Okay. Sorry.
What's lighting you up lately?
The mental freedom that is on the horizon for me. So
that is a gift.
mhm.
Mental freedom. I love that. And our last question, which I added because Rainn Wilson has it on his podcast and I loved it, is what's one life experience everyone should have?
Pelvic floor physical therapy, but not pelvic floor physical therapy, like come to Body Motion. There's a reason people cross the mountains every single week to come here and fly here. And it's
Wow.
because what we do is so different. And so, yeah, I think everyone should come and have like at least one time in your life where you are connected to your pelvis in a different way. And it just can teach you and train you to use your pelvis and use these muscles in a different way.
We
So,
haven't had anybody answer that question as a plug for themselves, and I love it. I love it. But that's
it's
true.
the truth.
I mean,
yeah.
I've never done it and I need to. And where can everyone find you?
You can find me at bodymotionpt.com. We're on Instagram at bodymotion. We're on TikTok as well, Facebook, Pinterest, YouTube.
You're everywhere.
Subscribe to us on YouTube, please. I'm hired someone recently to revamp the YouTube. Not even sure why. Not a great decision, but it is there.
We'll put all the links in the show notes. And also,
Beautiful.
it is a good decision in theory and in the long term because I recently heard that YouTube was the big winner in COVID because everybody was researching everything on YouTube. So even if you get a few little hits from AdSense, why not?
Okay.
And I heard today, if I get the link, I'll send it to you. I have a friend who there's some new AI thing that will take your videos and edit it as if a person did, but better. So
Ooh.
if you're just sitting there recording your video, it can do the splice and dice, zoom in, out things that people do on these platforms. And I need that. So I'll ask my friend who told me about it if she knows a link, because
Sweet.
that could save some delegation time for sure. Well, thank you so much, Allison.
Thank
This was
you.
amazing.
Yes.
And I know that you're everywhere in Edmonds, but that doesn't mean that people are actually coming through the door. So this personal connection is really helpful, because they, like we've talked about, they need that permission to come see you, and hearing it straight from you. Even for me, I see you everywhere and I was not giving myself permission. So to be optimal and optimally spiritual, I need to get in for my consult. So we really appreciate the time, and that you are a person in and around this great town as well. And we can't wait to see what comes next for you.
Thank you. Thank you for having me. This was so lovely.
Yeah. And thank you for listening to this episode of The Coast. Goodbye.